Okay, great. Hi everyone, so thank you for having me today. I'm Bella. I completed my Masters of Public Health this year at Melbourne Uni, and as a part of my final year, I completed a year-long research project at the RCH, which I was fortunate enough to do working with the Transition Support Service team. Before this, I had limited knowledge of the transition process or of the care of young people with CP, so it's been a huge learning curve. And I worked closely with my supervisors, Evelyn Carnane and Hayley Loftus from the Transition Support Service team. So now moving on to some background. So all young people with complex medical conditions or developmental disabilities face the challenge of transferring to adult health services when they reach the end of their time in paediatric care. And this can be an especially challenging time as it parallels the period of adolescence, which is a difficult time for all individuals as they aim to seek autonomy and independence away from their families. So this study was exploring the transition experiences of young people with CP who transferred from the RCH to adult services. And we basically wanted to understand their barriers and enablers to engagement and during transfer, and also the level of engagement in the adult setting, as the literature has shown that this can be a strong indicator of their transition experience and of the care coordination that they received. So I'll just define a couple of terms quickly. So the term transition refers to the period where young people, their families and carers prepare to transfer to adult services. And then the term transfer refers to the period where young people have left paediatric services and are in the process of switching to have left paediatric services and are in the process of switching to their adult providers. So transition services. They are services that have been designed to help facilitate and guide transfer and to help enable the young person to be able to manage their health more autonomously and independently in the adult setting, and also to ensure that the young person receives comprehensive care coordination to enable a smooth transfer between paediatric services and their new adult providers to ensure they receive a continuity of care. So the Transition Support Service at the Royal Children's Hospital provides transition support to adolescent patients who are 15 years and above, their parents, carers and treating teams. And basically transfer looks different for all young people with CP as they transfer to a wide range of health services and community services. In Victoria, there are 5 main clinics where young people with CP who transfer from the RCH commonly transfer to, and these are transition clinics within the adult setting that help young people and their families adapt to adult care. So from the RCH, young people with CP commonly transfer to the clinic at St Vincent's, which is the Young Adult Complex Disability Services, and also to the YATS, which is the Young Adults Transition Service at Monash Hospital. And there are also equivalent services in Geelong and Bendigo. And just to clarify, we interviewed just participants who transferred from the RCH. So we were only looking at the services available in Victoria as it does differ between states with the transition services available. So in terms of the methodology, this was a qualitative study. We conducted one-on-one semi-structured interviews, and the inclusion criteria for our study was a young person with a diagnosis of CP who had their last appointment at the RCH between 2016 and 2018. For the interviews, we used a semi-structured, an interview guide, which was developed and piloted with key stakeholders. This included Professor Dina Reddyhoff, who has extensive experience in the care of young people with physical disabilities, especially with CP. And we also piloted the interview guide with a young person with CP and a youth worker from the Transition Support Service. In terms of the analysis, the Braun and Clark 6-step thematic analysis was used to analyse the data, and at the end of each interview, I also took each participant through a health-related quality of life survey using the PedsQL 4.0. So this here is just an overview of our study cohort. We had 11 participants in total, and 10 completed interviews over the phone, while 1 completed written responses to interviews. And due to the situation, the restrictions this year, we had to complete interviews over the telephone, which meant that for those participants who couldn't complete the interview in a way that could be captured over the phone, they completed the interview via parent proxy. So where the parent completed the interview on behalf of their child. And we have had 5 complete the interview via parent proxy and 6 independently. The majority of our participants were female and most lived in metropolitan Melbourne. And participants had GMFCS levels ranging from 2 to 5. And there was also a mix of where they transferred to, with the majority transferring to the clinic, the transition clinic at St Vincent's, but also with a range of different community services and health services. So for the thematic analysis, we had 3 major themes which emerged from the data. The first one, preparedness of young person and parent, reflects the participants' experiences of getting ready to transfer to adult care and how the transition support service facilitated this process. The second theme refers to how having a well-coordinated transfer to adult services led to a more productive and positive experience in the adult setting. And the third theme refers to the post-transfer experience of care in the adult setting and the barriers and enablers to engagement. So the next few slides, I will just go through each theme with sub-themes, and there will be quotes to illustrate. So for the first theme, the first sub-theme, expectations of adult care, referred to how having an understanding of what adult care would be like, as well as the responsibilities and requirements of transfer after leaving paediatric care, enabled young people and their parents to feel more reassured for the transfer to the adult setting. Most participants also said that they had an understanding and expectation of the transition process during their time in paediatrics, which led to them expecting and receiving the support from the transition support service. There were a couple of participants, however, who said that during their time in paediatrics, they were not made aware of the transition process or of the role of the transition support service. And these participants, as a result, did not receive the same coordination and support that the other young people did. The second sub-theme refers to the different skills that young people said they developed during their time in transition to help them manage their health more independently in the adult setting. And this included things such as being able to explain their medical history to new providers, being able to advocate for health needs and preferences, and also administrative tips such as being able to manage appointments and medication. So the second theme refers to the coordination of transfer between leaving paediatrics and beginning care in the adult setting. And this included, a smooth transfer included things such as establishing which providers the young person would see prior to transfer. And this involved often working with the clinician to develop, to understand their health priorities and work out which providers they would see in the adult setting. Also included having a comprehensive referral, so having their medical history sent to their adult providers before their first appointment. And a few participants also said that they were lucky enough to have a point of contact or a coordinator in the adult setting. So this could have been anyone such as a nurse coordinator, a GP, an OT, a physio, someone who they could ask questions to, or or just enabled them to feel linked in to the adult services before they even began their first appointment. So for the third theme, the first sub-theme reflects how the majority of these participants found it difficult to adjust to the difference in the style of care in the adult setting compared to paediatrics. There were a few participants, however, who were able to accept the difference and appreciated the style of care, even preferring some aspects, such as the interdisciplinary style of care, which is common to the YATS clinic at Monash Hospital. And these participants said that this was due to the transition support service helping to manage their expectations before they began their time in the adult setting. The second sub-theme refers to the mixed experiences of these participants in the adult services being able to meet their needs. The majority of participants had a positive experience with their adult providers, but a few participants raised concerns about what would happen when their time in their transition clinic, such as at Monash or St Vincent's, came to an end, especially for those participants with no urgent medical needs apart from their physical disability. They were worried what would happen in the future should any CP related issues arise. And the third sub-theme refers to the shift from parent to young person that the majority of our participants spoke about in terms of managing appointments and medications independently. So now on to learnings and opportunities for future study. One of the main findings was the importance of preparation, which fed into both having a smooth transfer experience and also the engagement in the adult setting. This includes being able to understand the responsibilities and requirements of transfer before leaving paediatrics, both for the young person and for their family, and also for understanding what adult care would be like and how it would differ to paediatric care. And this management of expectations also includes understanding the transition process and how the transition support service will facilitate this process during the time in paediatrics. So I think a key takeaway from this is the importance of early transition planning. And this also feeds into the coordination between clinicians and the transition support service and how it's important for hospitals to have systems in place that enable young people who will continue on to adult services to be referred to transition support services to receive the adequate support and coordination. So in terms of future study, this project was initially meant to be a mixed method study, but due to the situation of this year, we limited it to qualitative data only, which we're still lucky enough to collect a vast amount of different information, and we had participants with different experiences, and we were able to reach data saturation. But it would be useful in the future to also use quantitative methods such as failure to attend rates or a more comprehensive quality of life measure. And it would also be useful to follow a cohort such as this several years after transfer to see how linked in they are to services and how well supported they feel. And this would also help to influence how transition planning and organisation can be structured. Future studies with in-person interviews would also be useful as we had to limit our data to telephone interviews only. This meant that young people who communicate via AAC devices could only participate through parent proxy. And I think it's important to recognise that some of the data that was collected via parent proxy may be slightly misrepresentative of the young person's own perspectives. So in-person interviews will be useful in future studies. And how these findings can be used by other states. It's important to understand who can provide support to the young person once they leave paediatrics, as there are not always transition clinics available to help organise this and to coordinate care. So the findings from this study highlight that the young person receives support from a range of services, including GP, physios, OTs, and the importance of early planning to establish the point of contact prior to transfer to the adult setting. And as mentioned above, one of the main issues was young people worrying what would happen when their time in transition clinics came to an end, as they were worried they would not be linked into any CP specific services in the future. So this highlighted the importance of having a good GP, so someone who knows the young person well and who can refer them to adequate services and refer them to the relevant providers if this is needed. And it is also important for paediatricians to be aware of transition and the need for early transition planning so that young people who need the care coordination and support from transition services receive it. So that brings me to the conclusion of my presentation. And please email CP Achieve if you would like to inquire about any of the information from these presentations today, and follow CP Achieve on Instagram, Twitter and Facebook. And thank you for listening.